My name is Dr. Emile Bacha. I'm the Chief of Cardiac Surgery at New York-Presbyterian Columbia University Medical Center, and also the Director of Pediatric Cardiac Surgery at New York-Presbyterian Morgan Stanley Children's Hospital. We cover the entire spectrum of congenital heart disease. So we do neonatal cardiac surgery, and we're going to be talking about that, but also mechanical heart assist devices. We do heart transplants. We do adult congenital heart disease, which is an emerging population of patients. So we cover pretty much the entire gamut of congenital heart disease and pediatric cardiac surgery with outstanding results. The team, the way they prepare for neonatal and infant cardiac surgery is a little bit different from preparation for an older child. A neonate, by definition, is very fragile. Everything is smaller, that goes without saying, but also their reaction to certain procedures is going to be different. They're going to be more susceptible to edema, to taking on water. Their heart beats faster, for example. The reaction of the heart muscle to certain medication is different in a neonate versus older kids. So because we know this, and the science has advanced quite a bit with respect to neonatal physiology and cardiac physiology, the team prepares differently in the sense that they may give different drugs. They may, the heart-lung machine is miniaturized so that we don't have to give a lot of volume to the baby when we go on the heart-lung machine. All of these things occur routinely nowadays, but they are part of why neonatal cardiac surgery nowadays has become extremely safe. We like to really focus on minimally invasive techniques a lot because the impact on the child is very positive long term, but also the trauma, because let's face it, every surgery is a trauma to the child's body. So if we can minimize that trauma, it's a necessary trauma because that's how we're repairing a child's heart. But if we can minimize that impact on the patient's body, it's much better. So we do it in several ways. Number one, the most obvious one, is we try to make small incisions. We don't make big incisions. We try to minimize the length of the incision. That has a cosmetic effect, number one, but also it has, if you don't have to make a big opening into a patient's body, obviously the pain is less, the suffering is less, and the trauma is less. That's the first thing. The way then the other aspects of minimally invasive cardiac surgery are a little bit more technical than the incision size, and they have to do with how we use the heart-lung machine, what kind of cannulas we use to hook up the patient to the heart-lung machine. All of these things in aggregate make the impact and the trauma of the surgery on the patient's body much less hurtful, if you will. And so we're able to do very complicated repairs, heart repairs, and the child can have the breathing tube out the next day and can go home within a week. And that's something that 10 years ago would not have been possible. I can't highlight enough how important it is to seek care in a multidisciplinary unit if you have a child, if you're pregnant with a child with congenital heart disease and you know the diagnosis from before birth. The reason that's important is children, sometimes the babies, get in trouble immediately after birth if they have a congenital heart defect. And of course, we can put the baby in an ambulance and transport the baby to a larger center, tertiary center that does all these things, or quaternary center. But it's better to be in one place under one roof. So in terms of advice to the parents, the most important thing that they need to look at is how experienced is the team taking care of my baby. So you don't want to go to a center that does 10 neonatal cardiac surgeries a year, or even 20 or even 30. You want to go to a center that does hundreds of neonatal cardiac surgeries a year, literally every day, every other day, operate on a newborn with congenital heart defect, because that is the only thing that ensures quality of care. We see hundreds of babies with congenital heart defects per year in our clinic. Now, of course, they don't all require surgery, which is a good thing. And if there's any way we can avoid to operate on them or do a less invasive therapy, of course, we'll do that. Because we're specialized and because we are very focused on neonates with cardiac disease, our outcomes have been really excellent. I would like to mention one more thing, which is very unique to this center, which is we have specialized neonatologists in cardiac disease. And that is something I worked in Chicago and Boston before, and this is really unique to here, where the neonatologists have taken it upon themselves to specialize in cardiac disease, which has resulted, in my opinion, some really very good management skills of those babies. Our outcomes are statistically superior than really most centers in the nation. I say that in all, humbly, but it's the truth. We participate in the STS congenital heart surgery database, which is sort of the gold standard. And so every year we get a report on how we're doing, and we're doing extremely well. I'll give you an example. Our all-comers mortality for the first half of 2012 is 0.9%. That's for all comers, 0.9%. That's an outstanding number that it's our best yet, and hopefully we can stay at that level.